Bell's palsy. Hi, here's another video on a very interesting clinical case. A crooked smile and drool in the right corner of the mouth were the chief complaints of the patient I had a few days ago. I noticed his smile deviated to the left side while the drool collected on the right. In addition to this, the inability to fully close his eye and hold air in his mouth led me to believe that the facial nerve was involved. However, speech and hearing remained undisturbed. A neurophysician confirmed that this was a case of Bell's palsy. Although I could not pinpoint the cause in this case, Bell's palsy can occur due to trauma, infections, inflammations, or nerve compression. Amongst these, the most common are viral infections by the herpes simplex virus. Other causative viruses can be the Epstein-Barr virus, the human immunodeficiency virus, and the hepatitis B virus. Let's now discuss Bell's palsy further. This condition is a sudden weakness or paralysis of muscles on one side of the face due to malfunction of the seventh cranial nerve, also called the facial nerve. While my patient had a unilateral partial palsy on the right side of the face, some can experience a complete palsy and rarely bilateral too. Usually, symptoms begin with slight pain around one ear, characterized by an abrupt weakness or paralysis of the muscles on that side of the face, causing a rigid mask like appearance. Fortunately, my patient did not complain of pain. Because of his inability to close his right eye completely, I warned him of complications like conjunctival dryness, ulceration, and watery eyes. I also noticed an upward and inward roll of the right eyeball when asked to close his eyes, a sign called the Bell's phenomenon. In some cases, involvement of the masseter muscle results in the retention of food in the upper and lower buccal and labial folds of the same side, along with slurred speech. Involvement of the chorda tympani branch of the facial nerve can result in the loss of taste perception on the anterior two-thirds of the tongue and altered salivary secretions. Patients with incomplete recovery of Bell's palsy can suffer from facial synkinesis, which is an abnormal, involuntary, associated facial movement. Common types of facial synkinesis are oral ocular synkinesis, which is an involuntary eye closure during voluntary mouth movement, and ocular oral synkinesis, involuntary mouth movement during voluntary eye closure. The etiology of synkinesis is not fully understood. However, aberrant regeneration of the facial nerve has been the most commonly reported cause. The good news I could give my patient was that Bell's palsy is a temporary condition that resolves on its own within a few months. Although, in most cases, no treatment is required, I followed a combined pharmacologic and non pharmacologic mode of treatment. My pharmacologic approach included steroids and antiviral drugs. Dosage options for steroids are 25 milligrams twice daily for 10 days or 60 milligrams daily for 5 days, followed by a daily reduction in dose of 10 milligrams for a total treatment time of 10 days. I advised lubricating drops for the eyes, but in instances where eye closure is not possible at all, an eye patch can be given to protect it. The non pharmacologic mode of treatment my patient followed was advised by a physiotherapist that included facial exercises like standing in front of a mirror and attempting to raise the eyebrows, opening and closing the eyes, blowing and whistling. With this, a full recovery was achieved in 8 weeks. In severe cases, Surgical management, like decompression of intratemporal facial nerve, can be done if required. Facial plastic surgery to create an anastomosis between the facial and hypoglossal nerve helps to restore partial function and improve appearance in patients with permanent facial asymmetry. If a patient does not recover within the expected time frame, a CT scan or an MRI can be done to rule out cerebral pathologies. With this, we come to the end of this session. We hope you had fun learning with us.
Pop quiz.